Okay, so we're going to do a tour, and I'm going to take you as a patient flow, what we would see as we enter the building. The family medicine is on this side to the right, convenient care is on the left, and dermatology is back in the corner. We also have radiology and lab services here. The nurse will call the patient back from this area. We'll walk out, call the patient back through the door. This is our vitals area. We're going to have 2 wheelchair scales. Okay, this is an exam room that I want to show you and the layout of what we typically do, what I typically do. So everybody says, well, why are the doors on the opposite side? Typically in a house or anything, you've got the door opening on the other side against the wall. So when I lay out for providers, I want the patient to have more privacy, so the exam table will be behind the door. When the provider or nurse walks in, then the patient will be here. We have the most updated exam tables here. They actually sit up into a chair position, and so normally we take the patient, set them in a side chair, do their blood pressure, vitals over here in the side chairs. We'll have 2 side chairs eventually. But we're changing workflows a little bit, and the exam tables are going to be in a set up chair position. They lower all the way to the floor, so easy for patients to get off and on. As you can see, this is horseshoe, is what I call it, nurse's station. And I like to do the open concept, because what happens is we've got a nurse for individual provider, and usually a float nurse that will work to help all of the individual providers. But we have a provider working out of 3 exam rooms. For 1, 2, 3 exam rooms will be one of our nurse practitioners, provider area. Her nurse will be here working. We actually designed this big enough to add another primary care provider here. So these 3 exam rooms here, this area won't be used until we hire another provider. So one of the things I really like in this building that I've never done in any of the buildings that we have for the medical group is the way that we put the blinds in. And we ordered a different kind of a blind that will help with the natural sunlight. And obviously being on where patients can be seen in an exam room, these blinds actually, you can put them up or put them down to bring the sunlight, or actually they go that way. And so obviously when you've got a patient in the room, you're going to have this because you can see out or see in for confidentiality, but you still can bring the blinds down and they have the natural sunlight in the rooms. So this is something that we've never done, and I think it will be a patient satisfier.
Right.
Okay, in primary care, we have a lot of population health patients that we are seeing, helping them with their health care, and we'll have a primary care coordinator out here and a team of a pharmacist and a couple other people that will help with the care. And so we have a specific office. So if we have a patient that needs to be seen from the primary care, we've got a specific office. This will be the office for the PCC, and we'll have a couple desks in here that we'll share, and we'll bring patients back to talk to the primary care coordinator if they need to talk to the pharmacist, to anyone else on that care team. So if you're in the primary care area where we just came from and we need to send a patient to lab or x-ray, it'll be done electronically obviously, but we'll route the patient through here. This is our radiology area where the actual tech will work, and this is our new radiology equipment. And our radiology supervisor manager, that I guess he's a manager out here, he is thrilled to death with the new equipment that we have. This is where we'll actually do the lab testing here in this area. But as a patient from anywhere in the building, we have centralized the lab and x-ray area. So we would send patients from this way and patients from this way to a small waiting room here. It'll have about 6 chairs in here. They'll have a seat, the electronic order will be sent to lab or x-ray, and then they'll know the patients are here. We also put a window in just in case. But we'll know if a patient's sitting here waiting, just in case something doesn't flow through. Obviously, the restroom for the draw area. This is the draw area where the patients will be called back from the lab x-ray or lab and x-ray waiting room. We'll have 2 flood chairs. This is obviously a bariatric chair. And then they'll have a seat and either be sent home or back to their area. So if you're a convenient care patient or a dermatology patient, you're going to check in just like the family medicine side. You'll be designated to a specific area in the waiting room to have a seat. And so if you're convenient care, this is the next area we'll see. You're going to be called back from this door by the nurse. You're going to be taken back to the back into the area, and this is actually designed exactly like the family medicine side. And one of the things I need to mention is we put our convenient care on a generator. So if we lose power, we still can see patients in the convenient care area and have lab and x-ray because they're on the generator as well. And if we're in the middle of a power outage and we need to bring primary care patients over here, say we've got a few patients still left to be seen, then we could bring them over to convenient care as well. But because convenient care is basically open 8 to 8, Monday through Friday, and Saturday 9 to 6, we felt like we needed some backup power for that. In dermatology, obviously, we want the most light that we can possibly get. So we chose to do the walls more of a white color because obviously in derm you need as much light as you can. So the blinds that come down will work really well for Dr. Cunapretti, our dermatologist here too.